And welcome to the June 29th press conference here in Seminole County, giving you an update on the dual crisis that we're dealing with and contending with here in Seminole County, one being on the health front, the other being on the economic front. I appreciate the news media for being here today to help us get the message out. I want to also thank many of the folks that are going to be here today to give our community a lot of data and updates. We've got all the major hospital systems here today that are going to give you what they're seeing at the hospital levels. We've got our typical and regular crew. Donna Walsh is going to be here from the Florida Department of Health to give some exact numbers and what we're seeing in the trends. I'll touch on some of those basically. Alan Harris from our Emergency Management Center is also here today, who is going to explain the new emergency order that is coming out. And we also have our medical director, Mr. Todd Husty, that everybody's become to love and see on a regular basis, not only at these press conferences, but throughout the media. Here in Seminole County, we're very, very blessed to have this type of talent to serve on behalf of the community. We're also very blessed to have the interaction and the collaboration from our hospital systems, and there's going to be a lot of detailed talk about that as well. You heard me talk from the beginning of this pandemic that there was a lot of things we didn't know. As things have moved on, there's a lot of things we do know. And so I'm going to cover a little bit of that and what it's going to do and what it's going to take from each and every one of us in the community to maintain our employment rates, not being shuttered any further, also allow our businesses to remain open as the most we possibly can. That all falls on each person's shoulders. A lot of people think this is politically driven. A lot of people believe that this is some kind of conspiracy. They think it's the flu. I'm telling you, it is not the flu. It is not a conspiracy theory, and it is not politically driven. So with that said, what we do know when we look back at the numbers, and it does not take a medical degree to determine this, when we look back in history of the data, at one point here in Seminole County, we did flatten the curve. That was the big talking point. We need to flatten the curve. We were successful in doing that. We praised the public, and I continue to praise the public for their vigilance and diligence in trying to do the right thing. Then what happened? We opened the economy back up. People went back to work. People were staying home. So what do we redact from that? Is that staying home worked. Interaction and a lack of interaction actually worked in flattening the curve. Now we're reopened. People have been locked up for months. Our young people have not been able to get out and socialize like they've wanted to. Even our elderly have not been able to get out and socialize. Now, behold, we have opened. We see the numbers starting to climb. And not only climb, but here in Seminole County, as well as many of the other Central Florida counties, it has climbed extremely high. So what does that tell us? That tells us the interaction has a direct impact as we get out and start to begin to open. As you know, Governor DeSantis has now closed the bars because of the outbreaks throughout the entire state. We're seeing beaches closed. We're seeing other directives from local municipalities come into play. This is to protect the public. This is also to allow business to continue to operate. We do not want to get back in a situation where we are forced by our state or federally to close businesses back down. We cannot afford to do that. That is, as we all have heard, myself as well as the experts up here talk about the mental aspect and how that impacts families in a far different way than financially. So this is a delicate balance. So what do we know versus what we don't know? I can't tell you what we don't know because I'm not a medical expert. What I can tell you is there are a few things that we do know, and that is social distancing. We know that works. How do we know that works? We stayed home. We stayed away from people. That works. We also know that cleaning your hands, keeping your hands away from your face, that also works. What else do we know? We also know that wearing a face mask helps prevent the spread. So now we're back interacting with the public. We're trying to get business back up. We don't want to shutter business again. We're interacting. People are getting tired of this dragging on. I think we're in day 106 of a pandemic. Nobody wants to deal with this, but we all have a responsibility for each other. But the face mask issue, we hear a lot of debate about, well, I shouldn't have to wear that, or I don't need to wear that, or you're violating my civil rights. Well, the reality is we know it works. So I would ask those people this question. We know that certain roads have a lot of traffic. So would you put your earplugs in, blindfold yourself, and walk across that same street? Well, that's basically what you're doing when you're not wearing a face mask out in public, when you're not able to maintain a 6-foot distance away from others. That includes when you're in businesses and when you're not able to maintain a 6-foot distance, then a face mask does work. You've heard Dr. Husty and others talk about the difference in face masks and what they know and what the experts know and all the data that's driven to tell us that face masks do work. And of course, there are different levels of those face masks. So I would urge our public and our community, pay attention to the speakers that are about to come up today, understand what they're saying, and understand that none of us may like what we're going through, but we have an obligation to our fellow man and to ensure that we're able to maintain an economic drive that hopefully will remain open and hopefully continue to generate jobs so we continue to work. Because if we don't, there's no telling, where we may end up, and I don't think any of us want to be there. So I'm going to give you a little bit of information. Beginning in June, we saw about our positive cases, 19 cases increase exponentially. Prior to June 9th, the highest number of positive cases in a single day was 29. That was back on April 1st. Last week, we've seen day after day of new records for highest number of daily positives. Since Monday, June 22nd, there have been 115 to 233 new cases every day. And what do we know about that? I think you're going to hear some talk about, 2 becomes 4, 4 becomes 8, 8 becomes 16, 16 becomes 32, 32 becomes 64, and on and on and on. And this asymptomatic, when people don't know they have it, I think is problematic. And I think what a lot of us don't understand is the acuity of it and what it really means. I don't know that we're going to know that for maybe years or decades to come. I just recently, this past weekend, interacted with a woman that was 102 years old in an ALF that was tested positive for COVID. There's not a single thing wrong with her. We continue to hear the elderly are most vulnerable. They absolutely are. We continue to hear the immune depressed folks are very susceptible. But now we're seeing young people who are now ending up in the hospital and now ending up very sick. So I'm not sure that we've completely, from a medical perspective, really figured out why some people are more susceptible versus some are not. And I think we may get some of those answers or get some trails to that from the experts today. But I think time will eventually tell. Although testing has expanded, the percentage of positives has been alarming. Since last Monday, we've tested no less than 662 patients a day, with a positivity rate ranging between 10.1 and 22.3. You've heard a lot of statements out there, well, we're testing a lot more people. Yeah, we are. But the nexus to the amount of people we're testing versus the positivity rate is skewed from the standpoint of it's not because we're doing more testing. We're seeing community spread. And I think you'll hear a little bit about that today and some more numbers. Prior to June, our daily positive rate was well below 3%. Dr. Husty talked about this. We've talked about this in our meetings. We were so thrilled. I think at one time we were actually at 2.7%. Now we're, headed back up, the wrong extreme way. Hospitalization ages have ranged from 22 to 97 years of age. It's not just the elderly folks. We heard that early on. And I think as this continues to unfold, we're going to see more of that. Roughly 7% of all COVID patients are currently hospitalized. Currently, we have 92 COVID patients hospitalized in our 4 hospitals, and 15 are in ICU. I think that's the highest number we've seen in the last few weeks as far as overall load. In a few moments, you're going to hear from all these healthcare providers, and they're going to tell us what they're seeing, what their expectations are, and why this is such an alarming concern for our public. We also are going to field questions once everybody gets done. But the reality is, in order for us to get back to some sense of normalcy in our community, we have to pay attention. we have to do what's right. A lot of these are burdensome on some people. Now, we know that wearing a face covering for some people for medical reasons, they're not capable of doing that. For other purposes or reasons, people can't wear masks, whatever that case might be. It may be a mental issue. I would urge our people in the public, when you encounter somebody within your 6-foot distance, I'd prefer you not have an interaction like we've seen on some of the news feeds that you want to pick a fight with these people or chastise these people. You don't know what their medical conditions are. My advice is just distance yourself and try to avoid those individuals and stay away from them instead of causing some kind of conflict. Also, message to our business owners. You heard me talk about this a month and a half ago before things opened back up. And now some of the businesses are seeing it because we've had businesses that have had to voluntarily shut down because their patrons and their employees have contracted COVID and they're not able to operate. It is your duty and your responsibility to not only protect your employees, but also protect the public by doing what's right. Enhance cleansing in your operation, maintaining that social distancing, ensuring that your patrons are doing that. And I know that's tough. A lot of times you get in a setting, maybe it's a restaurant setting, and friends run into each other, or neighbors run into each other. All of a sudden they're over there hugging and, I've been 2 months since I've seen you, we've been locked up. We would ask you just politely ask those folks to social distance. It's better for the entire community. We also have businesses, and I want to ensure our local business people, you do have the ability and you have the right to mandate face coverings coming into your place of business. That is your available option. We see Aldi, we see some of the big box stores who are now mandating this. What does that tell us? They want their employees to be safe, but they also want the public to feel safe when they come into their place of business so they can stay open. We know that when you go to a place, whether it be a restaurant or anywhere else, if you walk in and you see half the employees not wearing face masks and half of the patrons not wearing face masks, a lot of people are just going to turn around and go, you know what, I'll do it online, or maybe I'll do a delivery, I'll do these things. I don't want to take the chance. It's basically you're playing Russian roulette with the rest of the public by not wearing a face mask if you can't maintain social distancing. So enough of that. Again, I appreciate the public for paying attention, the vigilance. I would ask, regardless of age group, that you all be kind and considerate of your fellow man. We will get through this, but it's going to take work and respect from each and every one of us. So thank you again. Ms. Donna Walsh from the Florida Department of Health is going to share some numbers.
Thank you, Chairman, and good afternoon. This has been a very concerning week, as we have seen the number of cases of coronavirus increase exponentially in our county and across the state. As you can see from these graphs, hopefully the orange bars here show the lab-reported cases every day, and then the blue line shows the number of hospitalizations, which are growing also exponentially. Folks from our local hospitals will be talking about that in more detail with you, about the number of cases they're seeing in their hospitalized patients with coronavirus, as well as the acuity. To date, the state has reported 146,341 positive cases. That's as of midnight last night, and report this morning with 3,419 deaths. In Seminole County, almost 2,500 confirmed cases to date. That's 2,477 with 16 deaths. And as Chairman said, 92 current hospitalizations, 15 of those in ICU. We have overall a 6.7% positivity rate. We did get down to about 2.2% positivity rate. As you can see from this chart, the red line shows you the daily positivity rates is definitely climbing. Certainly we are testing more people, but out of the total number that we test, the bottom graph here shows you the daily positivity rates, and we did get as high as 22.2% positive in one day. We've been in double digits pretty much the whole month of June, and again, that's very concerning. In June, we started the first week off of June at 215 cases reported. The previous week, May 31st to June 6th, was 40. So just in those that 2-week period of time, we jumped significantly. The week of June 14, 507 cases, and last week, June 21st to the 27th, 1,112 cases. We did talk about before the shift in age group. We certainly are seeing a shift in the ages of folks who are becoming positive, but that doesn't mean that the other age groups are exempt, no doubt, because we're seeing it throughout. Just in our 20-year-olds, 20 to 29-year-olds, about 34% of our cases. In our 30-year-olds, 16% of our cases. So about 50% just in the 20 and 30-year-olds. And if you add the 40-year-olds, it's about 63% of our cases to date. That's total. We do know that our elderly and those with underlying health conditions still are very much at risk for complications of this virus. And it's good that they are, taking heed to the warnings and the advice of protecting themselves so that they don't contract this virus. So if you look at just last 7 days alone, June 24th to June 29th, 810 cases were reported. That's 33% of our total cases reported to date since this outbreak occurred. And if you look at the total month of June in Seminole County, 1,926 cases have been reported, which is 77% of our total number of cases since we've been, started with this outbreak. So I encourage you to continue, as Chairman said, and as others will say today, is to continue to protect yourself. The message has not changed. If you're going to be less than 6 feet from somebody, please wear protective face coverings, wash your hands, and make sure that you are taking those precautions to protect others. I will tell you, because of the number of cases, we have asked for additional resources through the health department. If you do test at a community pop-up site, please go to the apps that are available to you, either through LabCorp, Quest, or other laboratories. You can check your own results. If you see that you are positive, please isolate yourself. The current CDC recommendations are that you isolate for at least 10 days, and you don't go out and about again until your symptoms improve and you've been fever-free for 72 hours. Also, notify your close contacts that they need to be in quarantine for at least 14 days. If you need services, just as before, we've talked about this a number of times, the county has been supporting us from the very beginning. So if you need medication, food, or any other social services, please call the Citizens Information Line, and they will accommodate those needs. And that's 407-665-0000. So with that, I encourage you to continue to protect each other. Know that this is serious. It's growing, unfortunately. But as we have said from the very beginning, together we can get through this, and we just need everybody's help. With that, I'd like to introduce Dr. Hendricks, or actually Alan Harris. I saw Dr. Hendricks over there, Emergency Manager for Seminole County.
Thank you, Donna. Good afternoon, everyone. Seminole County continues to believe that we can rebuild the economy and stay safe at the same time. These are not mutually exclusive concepts. They can be done together. To keep the economy going, we must do our part by minimizing the spread of the virus. Unfortunately, as Chairman Zimbauer said, we have reports of businesses having to close due to illnesses of staff and patrons. This has been echoed also in faith and nonprofit summer camps, daycares, and libraries. Social distancing, facial coverings and masks, and frequent hand washing are simple actions which can prevent the spread of this virus. If these measures are done, medical experts, which are about to speak, have stated that the spread of the virus will decrease and the economy will continue to rebound. As Donna mentioned, we are offering services to anyone that is COVID positive. Those services include food, medication, even up to pet care. We call each of our COVID positive patients every other day to check on them as they're isolating and quarantining in their homes to make sure that they're okay and that they don't have to leave their home. This is just one of the services we're providing to individuals that are isolated and quarantined in their homes, so they have services and they can prevent the spread of the virus by not leaving their house. Today, Seminole County issues an executive order requiring social distancing and the use of facial coverings and masks. It emphasizes the importance of maintaining 6 feet distance in between employees and patrons, ensuring meetings, workshops, training programs maintain appropriate social distancing, and the use of markings on floors at checkout lines, queue lines, and storefronts. Most businesses are doing this today. Every person working, living, visiting, and doing work in Seminole County is required to wear a facial covering or mask consistent with current CDC guidelines as a measure to prevent the spread of this virus. Exemptions include children under the ages of 2, which is CDC guidelines, individuals with medical conditions, as Chairman Zamora mentioned, in which a facial covering and mask would be an impairment to them, persons working in a professions who do not interact with the public and can easily maintain a social distancing with any coworker, persons where facial coverings would prevent them from doing a service or obtaining a service. That would be like a hair salon, getting a beard trim, or a facial and a massage therapy or something like that. Obviously, persons are eating and drinking. They can take the mask off. Persons exercising while maintaining social distancing. And I can say that our exercise, our gyms in Seminole County, we have had at this point no outbreaks in any gyms. The gyms have been very good about keeping things clean, social distancing. Many of the gym owners have contacted us, getting advice and suggestions. I know they've contacted the hospital systems too, because they want to be open and they want to do it safely. Also, persons communicating with someone who is hearing impaired and must see their mouth in order to communicate. This is also an exemption of the facial covering and mask. Seminole County seeks voluntary compliance with this order. The county will continue to provide education as we have and will continue to do so. If noncompliance is identified, such neglect will be turned over to the appropriate agency for review and action. Since the beginning of COVID-19, Chairman Zimbauer and I have stated how important it is to get outside. This is not a stay-at-home mandate. It is important to go out, exercise, walk a trail. All of our parks and trails have remained open throughout the entire event. We are asking for social distancing while you do that. Take a bike ride. Enjoy one of our trails. Take a hike. Go to one of our parks. Enjoy what Seminole County is called. Seminole County is Florida's natural choice. Enjoy the natural choices that we have here in Seminole County. Take a walk around the neighborhood. This step is being taken as a recommendation of medical experts. Today we have representatives, again, from all 3 hospital systems. We're really honored to have all 3 hospital systems with us today. And first, I will turn it over to Dr. Hendricks, Medical Director, Advent Health, CentraCare. Dr. Hendricks.
Thank you for having us today. Advent Health is proud to fully support all these efforts by our local governments and leaders to encourage people to use masks. We know that the single most important thing to slow transmission of a virus in the absence of a vaccine is using these face masks. We have seen a steady increase in the number of patients coming into our facilities and hospitals since Memorial Day. When people started getting out and socializing and spreading the virus, we've seen predominantly in younger people. Initially, at CentraCare, we had a large number of young people coming in, college age, that were testing positive after Memorial Day, and that's gradually transitioned as we've seen it become an older age group. And to my fear, we have seen a similar increase now, not just in young people, but in hospitalizations. So we're seeing people in the hospital as a result of this increase. So just the fact that we're seeing more cases, we are testing more people, we are having a higher percentage of those tests come back positive. I can tell you at CentraCare right now, 21% of our tests are coming back positive that we're doing in urgent care. At its worst, during the previous surge back in April, that number was 12%. So it gives you some perspective on how pervasive this virus is in our community. And I think it's very important that we do whatever we can. Part of the social contract of actually being out in the community and trying to get back to normal is going to be wearing these masks. I'm going to take off my mask for just a second so my message can be heard loud and clear. This is the single best way we can prevent transmission. I myself have no symptoms right now, but in a matter of 2 days, I could wake up with a fever. That means anybody within 6 feet around me could be at risk because I could be transmitting asymptomatically. So that's why it's so important to wear these masks, because we wear the masks so I can protect you, because I care about you. I care about myself and preventing transmission, but also I don't know if I'm developing symptoms. I want to protect you. I want to protect my community. I live in the Vito. I live in Seminole County. I've worked in Seminole County for well over 20 years now, and I care about my community, I care about my neighbors, and I care about my family. So let's do this together. We can all wear masks, and we can slow down transmission so it doesn't get any worse than we're seeing over here. Thank you.
Thank you very much, Mr. Chairman, and good afternoon, everyone. Happy to be here with you. I'm Dr. Sean Benoit. I'm the Chief Medical Officer at Central Florida Regional Hospital here in Sanford. Early on at Central Florida Regional, we're a member of the HCA Healthcare family, and we recognize the importance of implementing a universal masking policy to protect everyone who walked through our doors of our hospital. So we mask everyone, and we recognize how important that was. As a company, we felt strongly that this was necessary to protect our patients, our dedicated colleagues, our guests, our communities at large, and we implemented it enterprise-wide throughout all of our hospitals in our system. Today, we do stand here in support of Seminole County in their efforts to take measures to protect our community. The increase in the numbers that everyone has been hearing, both locally and statewide, is consistent with what we're seeing in our hospital. So we have seen an increase also in our patient population. Our age range is actually between 20 and 85, so we have quite an age range there. As everyone knows, COVID-19, coronavirus, spreads mainly from person to person through respiratory droplets produced when someone coughs or sneezes or talks or raises their voice or shouts. So this is a little graphic, but these droplets can land in the mouths or noses of people who are nearby and be inhaled into your lungs or land on surfaces. So I want to talk about this for a second because a lot of people get confused about the viruses, and many of you have heard people talk about microns and size of viruses and masks, etc. So here's the thing. The virus does not travel by itself in the air. The virus travels on droplets. So people talk about masks and cloth masks and these masks and N95s. Do they have the right size? But the virus, which travels in droplets, the droplets can absolutely be blocked by the mask that we're wearing. And that's why wearing a mask is so important. Masks help prevent people who have COVID-19 from spreading the virus to others. Recent studies have shown that a large portion of individuals, 25% in some studies, with COVID-19 are asymptomatic, as mentioned earlier, and that even those who do develop symptoms, we call those people pre-symptomatic, they can transmit the virus to others. And in some studies, that number of transmission is very large. So wearing a mask will protect people around you, including those at higher risk of severe illness from COVID-19, and workers who come into close contact with other people. You know, one study showed that in states that mandated face masks, and we have been following this for some time now, in states that mandated face masks in public use, that there was a decline in the daily COVID-19 growth rate. So that's something that's very significant that you can actually see within the past few months that growth rate has been less if they're wearing face masks. We looked at another study and at coronavirus deaths over 198 countries, and it found that those with cultural norms or governmental policies favoring mask wearing, those countries had lower death rates. So the mortality rate was affected as well if you were wearing a mask. So the spread of COVID-19 can be reduced when masks are used along with other preventive measures, including social distancing, as you heard about earlier, frequent hand washing, and cleaning and disinfecting frequently touched surfaces. Thank you very much for your time. And I'd like to bring on Bridget Zamora, Chief Nursing Officer, Orlando Health, South Seminole.
Thank you, Doctor. That was great information. Good afternoon. I'm Bridget Zamora, the Chief Nursing Officer for Orlando Health, South Seminole. I'd first like to say thank you to Seminole County for your leadership and for making this decision today. Over the past few weeks, our hospitals have watched the COVID-19 patient numbers steadily rise as we get out into the business world and the activities that we so much love. Even as cases rise, Orlando Health remains equipped and prepared as ever to care for the community. We continue to do those things that we need to care for each other. Mandatory masking and social distancing makes sense, and it serves as a reminder of a few simple steps we can all take to protect those around us that we care about. It is the right thing to do, and we encourage everyone among you, your closest friends, and your families to practice social distancing. Looking at the hospital trends over the past several months, we are reminded of what all of us are capable of doing. As you talked about a little bit earlier, we flattened that curve once, and we can do that again. This disease is something that's not going to go away right away, so we have to be careful about the things that we do and use intentionality in what we're doing. We're proud to serve South Seminole, and we're proud to be part of this community effort. Thank you for having me, and thank you for all of you all making this decision today.
Hi, I'm Todd Husty. I'm here to clear up some misconceptions and maybe some mixed messages. I first want to thank all the hospitals for being here. When we saw this happening, it was just a matter of time before we really needed to do something different. And I thank everybody for the support, 100% support from our medical folks in Seminole County. Couldn't be happier. Want to make a huge point that right now there's no hospital in Seminole County that's really overwhelmed. Seeing increases, absolutely, and when you see a curve and it's going up and up and up, you go, okay, so at what point do we get into trouble? You've all seen in the news that Houston is in trouble. Houston, about a month ago, wasn't that bad. Not that bad at all. It just skyrocketed out of control. There was a time in New York where they had fewer cases than we have right now. They got the big curve. They started going up like this. We do not want to be New York. Feel badly for them. Houston, feel badly for them. We do not want history to repeat itself in Seminole County. Acuity. There's been some talk about acuity. We talked this morning with the hospitals. For a while there, everybody's saying, well, this isn't so bad. It's just in the kids. Well, I think that's a false narrative. It is bad. It's bad because it's in the kids. There are kids that get really ill. Not as many. So you could sort of see that since it's in an age groups that are less acute, generally, the overall acuity will look different. It's the face of the virus, not actually the virus itself. But as that leaks out into the community, then we start seeing other people, and the other age groups that have higher acuity admissions, we see it happening. And that's what's going on. We heard from the hospitals today that we now have people on ventilators. We haven't had people on ventilators from COVID for, I don't know, it's been a months about that. Here they are. We're going back, getting worse, getting more cases, and they're getting worse. So acuity, I don't think this virus has changed. I mean, there has been talk about maybe the virus has changed. You know what? It's way too early to rest on that. As a matter of fact, we really need to do the opposite. I spent a lot of time this weekend researching through the College of Medicine, UCF College of Medicine, through the library. I wanted to do a literature search to find out, do masks work or not? Actually, Chairman Zembauer kind of goosed me on this and said, can you show me, show us what the studies are? So I started searching, over and over and over again. Then I called my son. I have a son, he's a bit of a disappointment, he's a surgeon, and if you're in medicine, you understand that. He's a great guy, serving proudly in the U.S. Navy in Virginia right now. And I called him up. I said, is this a debate amongst physicians? I mean, the young physicians? And he goes, no, it's not a debate. We don't debate face masks. In medicine, it's a given that these things work. End of story. No debate. Then, thinking about my son one more time, he did tell me he's being transferred to Jacksonville. New orders. Going to be doing a fellowship at Shands Jacksonville in the Navy. His wife and my 2 grandkids, his son and daughter, have already moved. Well, he's not allowed to travel because the U.S. military, especially the Navy, they're all allowed to make their own decisions. But the Navy on the East Coast has said, you cannot travel to Florida because it's too hot. There's too much COVID. You cannot travel out of Florida because it's too hot. There's too much COVID. He's going to have to get a special waiver from an admiral to be able to move and be back with his family. Why are they doing that? Are they doing it because it's political? Really? No. It is not political. It's because they're afraid that if servicemen and women interact with the public, that they're going to decimate and weaken our armed forces. Makes sense. Here's the weird part. The very people who are protecting our freedoms, to be able to protest, to be able to complain about masks, to be able to do anything, that protecting our freedoms are having their freedoms taken away. They're back to pre-phase 1. They can't go anywhere except for non-essential businesses. I mean, except for essential businesses. They can't go to the gym. They can't get their hair cut. And they can't travel. They are being held down. They're losing their freedoms for us. Please respect that. And respect your neighbors. I've got a little pin on that says, I wear masks for you. Well, okay, I'm 68. I wear this one for me too. But, I mean, that is the truth. But please respect each other. This will keep you from getting it if I get it. And yours will help keep me from getting it and everybody else. So we need to respect each other. Thank you. Chairman?
Well, thank you all again for joining us today, and thank you for our hospital representatives and doctors that were here today to help our public better understand. Hopefully, you all understand the urgency of this matter. You understand the gravity and the weight of this issue, which really boils down to where we go from here is not on me. It's not on this government. It's on the community. That means everyone in this community has to do their fair share. Common sense, real easy. If you can't maintain that distance or you're in a setting, put your mask on. If you're a business or if you're having trouble finding masks and you believe you're unable to procure such, then all you've got to do is pick up the phone and call 407-665-0000. Our Emergency Operations Center personnel will guide you and connect you with the source so you can get whatever supplies you may need. You know, we heard a lot early on. Save these for hospitals. You know, we have low counts. Since then, the pipeline has been filled. There's a lot more personal protection equipment out there and available. So if you're having trouble, please, 407-665-0000, which is our hotline here. We will help you find your way in that regard. Also, last week, I want to give you an update. You heard us talk about the business grant program. Continue to watch our website at Alert Seminole for data coming out that businesses can apply for additional grant monies. So before we move into our Spanish translation, we'll take questions for any of the speakers today from the press.
I have a question. I wasn't here last week, but I was hearing that the mask mandate was asked about. You guys said, no, we're not going to do that. And how would we be able to enforce it anyway? So what changed your minds?
Well, I don't know there's been any change in mind. I think it was the parameters in which that was done. There was talk about a mandatory mask that everybody outside wearing, no matter where they were at, we're going to have to wear a mask. I mean, I don't think it takes a rocket science to figure out when you got 500,000 people in a community and you got 400 plus or minus sworn officers, they can't be running around trying to enforce everybody wearing a mask, as well as equip those people that have medical concerns with some kind of ID card that would prevent them from some kind of action being taken. This is much different. This is within CDC guidelines, really pushing the CDC guidelines of maintaining that social distancing. And as the order says, if we have complaints or concerns where this is not happening, then the appropriate departments and authorities will take action.
What do you tell people who just refuse to wear a mask altogether? We've seen videos on Twitter and everywhere else about these people that are just refusing. They think they can get into businesses without putting a mask on, and they, threaten the businesses.
Sure. Well, I mean, look, as we go through life, there's people that don't obey speed limits. They don't wear their seat belts. They continue to use their cell phones. They want to make a political statement or a personal statement. And ironically, if you follow some of these people around or you happen to run into them, they're wearing a mask when we're in the supermarket. So the question I have for those people is, if you're going to make those kind of statements, then why are you wearing a face mask if you're saying you're not going to wear a face mask because it's your civil right? I have a core belief. Your rights end where they infringe upon mine. And that's the reality. The reality is we owe it to our brothers and sisters in this community. We all have rights. But please don't go off on a political tangent that you don't have to wear a mask and just because it's self-serving. Do what's right. I mean, that's all we're really asking. Do what's right. We really don't want to penalize anybody. We don't really want to go down that road. And for the most part, 99.9% of the people in this county will do what's right. Yes, sir.
Ahead of the 4th of July holiday, some jurisdictions are closing beaches. Not an issue here, but do you foresee any type of closures so folks can make their holiday weekend plans?
Well, I think we've tried to make it pretty clear with our policy group. We meet on a regular basis, and we're monitoring as things unfold. We have a lot of tools in our toolbox. There's nothing at this juncture that I've seen that rises to the level that would prevent that. But certainly, on a moment's turn, if we have to take action, I think this group has proven we're ready to do so.
Voluntary compliance, numbers increasing, what would you have to see, or realistically, what's going to happen to either go for Seminole County to go down a phase, to have stricter restrictions on the public? Because we keep hearing all these warnings, but yet what about the actions to protect the people? So what is it going to take for people to have to see action?
Well, I think we're sort of in a rock and a hard spot, if you would. The state has mandated businesses will be open. I agree with that. I agree that the mental impact, financial impact is as far-reaching as the health portion of that. There's only so much we can do. I think what we are expecting is compliance for the good of each other in this community. And our other expectation is, if they're not doing that, my expectation is the good people that are paying attention are going to put peer pressure on those ones to say, look, straighten up. At the end of the day, it's on the people's back. I mean, it's up to you. If you want to open up business, get to the next phase, we all have to do our part. So what I would say to those individuals that want to make those statements is, as you continue to delay us getting back opened and going to the next phase, that's on you, not on the people that are doing what we've asked them to do. So understand, your little political statement or your personal belief of your rights have now caused harm to somebody's family, their ability to earn a living, maybe the business they work for. Why and how? Because we can't get to the next phase. And as long as these numbers continue to go up, I think it's been pretty clear from the federal government to the state government right on down, we've got to see compliance, and we've got to see numbers flattening out before we can go to the next phase. And here we are, bars are being closed, we're now going backwards in time. This is a problem. I think this is a warning shot of, hey, I think this governor is ready to make decisions, very hard ones, I must say, if he's forced to.
Yeah, to make sure that we characterize the new executive order properly. I know that we're talking about there are things that are exempted because of age or health or various things. Also that you want voluntary compliance, but if necessary, you'll,
Correct.
pay for it. It is a mandatory mandate, right? I mean,
Absolutely.
You are making mask mandatory. I know the word is requirement, but
Right.
with other counties saying mandatory, you're in line with them now.
That's correct. It's mandatory under the conditions outlined in the executive order. Again, we all have to understand, and to the question of Jeff earlier, the problem with an outdoor 100% all the time mask mandate is, look, we could all argue with the temperatures we have here in Florida. I'm native to Florida. If you're going to go outside with a 98 degree with a heat index of 103 and there's nobody around you wearing a mask, it's probably not the safest thing to be doing. So to mandate 100% of the time everywhere you go really doesn't make sense, because the reality is, what do we know? Distancing is what helps stop the spread. So that 6 foot distance is really what we're asking. And if you get inside those 6 foot areas, don your mask. Just do what's right.
Responsibility of businesses. So if there's a person in a restaurant who's not eating, maybe they're in the lobby waiting for a table and they're not wearing a mask, and another customer calls you guys or the county and says, hey, I saw so-and-so not wearing a mask in whatever restaurant, can they be held to account? Will they face a penalty for customers not wearing a mask?
Sure. So the question is, does business have an obligation? Can they face some kind of penalties and so forth? I think the governor's made it pretty clear, and we in our order as well. If a business is grossly just ignoring and not ensuring that their employees and patrons are doing the social distancing, then absolutely we have the ability to fine. So the businesses have a responsibility, and the question is, well, maybe they're in a waiting area waiting to go into the restaurant, they don't have a mask on. Well, it's pretty clear, if you're not eating or drinking, you should have your mask on. So that would mean if you're waiting in line outside the restaurant to get in, or if you're sitting in a waiting area waiting to be called to your table, then the expectation is you would have your mask on. Absolutely.
Have you been in touch with DPBR, and are they going to have people in the county looking this over
They
to
do,
make
yes,
sure?
they currently do, and will continue to do so. And we understand we're going to get additional help from Tallahassee. There will be a heightened increase in that, looking at all these organizations and operations to make sure that they're complying.
Question for one of the hospital representatives. Dr. Husty said that hospitals are not overwhelmed right at the moment. Can somebody maybe give us some insight in general of what's happening behind the scenes, perhaps to manage beds for 2, 3, 4 weeks out, or not, whatever? Kind of give us an insight of what the hospitals are doing just in case we do see a larger wave come.
Yes, thank you for your question. So we are paying a lot of attention to our numbers. Throughout our system, we have what are called crisis care committees that meet very often, and we review our ventilator numbers, we review our bed numbers, our ICU stays, how many people are in there, our COVID wing in our hospital, how many people are there. So we're looking at this all the time, our supplies and our PPE. So what we do is prepare all the time, and we have stand-up committees where we look at our numbers. A lot of that takes place behind the scenes, but trust me, we're very, very careful to make sure we are preparing for our numbers. As you know, during the months of March and April, there were lower numbers and things have happened. So many hospitals now are increasing those numbers. A lot of people have always been in the ICU who were not COVID patients. That hasn't changed. So all the hospitals are still taking care of very sick people in the ICUs. And nevertheless, we want to make sure that we have enough beds for them. We keep track with all the different representatives here to see how many beds there are in the county. And so we're very confident that right now we can take care of the patients, and they should be able to come to us, and we will do so.
No further questions for any of the speakers today? Well, again, I want to thank the media for being here and helping us get out the message. I also want to thank our hospital representatives that are here from our 3 hospitals here in the region to help our community clearly understand. I know your time is very busy, and taking that away from your operations speaks volumes to your commitment to our community as a whole, and we thank you for that. I also want to thank, again, the community for doing the right thing, being vigilant, paying attention. I want to thank the business owners to continue to try to do the right things and try to find your way. Again, if you need any guidance or any assistance with any protocol whatsoever, pick up the phone at 407-665-0000. We have a lot of information that we're happy to share with you. If you just don't know what to do and can't find your way, we're happy to do that. And of course, pay attention, watch the Alert Seminole website for the business opportunities with the grant monies that are going to be coming out. And finally, I want to thank the policy group. And I got to tell you on behalf of myself as a elected official, when all this started, this was my first term as a commissioner. Also, I was made the chairman of this Board of County Commission. Forged in fire, I guess they might say. I have reached deep into my faith as well as my life experiences to try to get through and help my community get through that. I will tell you and assure you that this policy group, who is comprised of different political backgrounds and all different opinions, including our 7 cities, has come together and continues to do what's right for the community as a whole. That speaks volumes of the character of this community, and I'm very thankful for that. So with that said, again, thank you very much. Be safe, wear your masks, and now we're going to have our Spanish translation. Take care.
Muy buenas tardes. Este es el resumen de la conferencia de prensa. En primer lugar, el presidente de la Junta de Comisionados del Condado, Jason Bauer, habló y le dio la bienvenida a todos. Habló sobre muchas personas que piensan que esto no es verdad, que esto se lo han inventado, que realmente no está ocurriendo nada en cuanto al COVID. Lo que sí sabemos es que en un punto sí bajamos la curva y luego abrimos la economía y todos comenzamos a salir. Y el quedarse en la casa sí funciona, o sea que sí vimos que el utilizar máscaras y el distanciamiento social se puede utilizar y causa resultados. Desde el principio de junio hemos visto que los casos positivos de COVID-19 han aumentado exponencialmente. Desde el lunes 22 de junio ha habido entre 115 y 233 nuevos casos cada día. Desde el lunes pasado le hemos realizado la prueba a 622 personas o pacientes al día, con una tasa de positividad entre 10.1 y 22.3% diarios. Antes de junio esa tasa de positividad era menor de 3%. Hemos visto también un aumento en las hospitalizaciones. Las edades de hospitalización han oscilado entre los 22 y 97 años de edad. Este virus no es solo para los ancianos, así que los jóvenes también hemos visto que pueden tener el virus y pueden estar hospitalizados. Aproximadamente el 7% de todos los pacientes positivos de COVID están hospitalizados. Actualmente tenemos 92 pacientes COVID hospitalizados en los 4 hospitales y 15 están en la unidad de cuidado intensivo. Desde el comienzo de esta pandemia hemos apoyado la guía de los CDC para usar máscara, distanciamiento social y lavarse las manos con frecuencia, ya que sabemos que sí, esto funciona. Hemos visto una serie de empresas temporalmente cerrar después de la presencia de casos positivos conocidos. Si bien las agencias reguladoras no requieren esto, vemos lo que las empresas están haciendo para proteger a sus clientes y empleados. Es su deber cuidar a sus empleados y clientes. Usen máscaras y acuérdense de desinfectar. Ustedes pueden hacer mandatorio, obligado a sus clientes usar la cobertura facial cuando estén visitando sus negocios. No tenemos la intención de cerrar nuevamente la economía. Queremos ver a nuestros residentes mantener una sensación de normalidad. Queremos mantener a la gente empleada y queremos mantener las empresas abiertas de forma segura. Y sabemos que podemos hacerlo con éxito si tomamos medidas adicionales. Así que usar la máscara es importante cuando sale y cuando no puede mantener un distanciamiento de 6 pies de distancia. La directora del Departamento de Salud del Condado de Seminole, Dana Walsh, habló sobre las gráficas que están aquí al lado que muestran, pues, en el caso de la línea anaranjada, los casos reportados y el azul, los casos de hospitalizaciones, que ambas van hacia arriba. La Florida tiene un total de 146.341 casos positivos y 3.419 muertes. En el condado Seminole hay 2.477 casos confirmados, 16 muertes, actualmente 92 hospitalizaciones y 15 en cuidado intensivo. Y la tasa de positividad es 6.7%, o sea que ha aumentado a lo que habíamos visto anteriormente. Entre las edades de 20 a 29 años de edad en el condado Seminole es un 34.39% de los casos, así que es la más cantidad de casos es en las edades de 20 a 29 años, seguidos por los 30 a 39 años de edad con 16.61%, así que son los más jóvenes. Del 24 de junio al 29 de junio se han notificado 810 casos al Departamento de Salud, que es un 33% del total de casos. En junio nada más, hasta esta fecha, Seminole ha tenido 1.926 casos, lo que es el 77% de todos los casos que hemos recibido. Si se hace la prueba en el Departamento de Salud, recuerde que pueden descargar la aplicación del laboratorio y se les dan unas instrucciones que usted puede visitar, ya sea a través de los laboratorios de LabCorp o de Quest, donde pueden ver sus resultados. Los resultados o las pruebas en el Departamento de Salud también le hacen la prueba a los niños, así que pueden pasar por allá de lunes a viernes, hasta ahora, esta semana de lunes a jueves, de 9 de la mañana a 1 de la tarde para hacerse la prueba. Cuando usted se hace la prueba, si el resultado es positivo, recuerde que se debe aislar por lo menos 10 días hasta que ya no tenga fiebre por 72 horas. Si no tiene síntomas, también debe aislarse y decirle que a las personas con las cuales ha estado en contacto para que ellos sepan y puedan realizarse la prueba y también estar en aislamiento. Le exhortamos a que usen precauciones para protegerse los unos a los otros. Juntos pues podemos salir adelante. Luego, Alan Harris, director del manejo de emergencias del condado, mencionó que el condado de Seminole sigue creyendo que podemos reconstruir la economía y estar seguros al mismo tiempo. Estos no son conceptos mutuamente excluyentes, van de mano a mano. Para mantener la economía en marcha, debemos hacer nuestra parte para minimizar la propagación del virus. Desafortunadamente, tenemos informes de negocios que tienen que cerrar debido a las enfermedades del personal o de los clientes. También ha pasado esto en los programas de campamento de verano, en guarderías, en las bibliotecas y en las iglesias. El distanciamiento social, cobertura facial y máscaras y el lavado frecuente de manos son simplemente acciones que pueden prevenir la propagación de este virus. Si se hacen estas medidas, los expertos médicos han declarado que la propagación del virus disminuirá y que la economía seguirá adelante. Le damos servicios, también el condado da servicios de alimento a las personas que salen positivas y otros servicios más, así que para que no puedan salir, no tengan que salir de su casa, ya que pues no queremos que expongan a otras personas. En el condado Seminole hoy se emite una orden ejecutiva que requiere distanciamiento social y el uso de cobertura de máscaras faciales. Enfatiza la importancia de mantener la distancia de 6 pies entre empleados y clientes, asegurar que durante reuniones, talleres y programas de capacitación mantengan una distancia social adecuada y el uso de máscaras en las filas para pagar, las filas de espera y fuera de las tiendas también. La mayoría de las tiendas ya están realizando esto. Cada persona que trabaja, vive, visita y hace negocios en el condado de Seminole se le requiere usar una cobertura facial o máscara consistente con las pautas actuales de los Centros para el Control y Prevención de Enfermedades como una medida para prevenir la propagación del virus. Las exenciones, hay unas excepciones a esta orden que incluyen niños menores de 2 años de edad, ya que no pueden utilizar máscara, individuos con condiciones médicas en las que una cobertura facial causaría molestia o deterioro, personas que trabajan en una profesión que no interactúan con el público y son capaces de mantener el distanciamiento social de los compañeros de trabajo, personas en las que una cobertura facial impediría el deber o recibir el servicio, personas que están comiendo y bebiendo también, no se tiene que colocar la máscara, personas que hacen ejercicio o mantienen el distanciamiento social, y las personas que se comunican con alguien que tiene problemas auditivos y deben ver la boca para comunicarse. El condado de Seminole busca el cumplimiento voluntario de la orden. El condado continuará proporcionando educación y si se identifica el incumplimiento grave, dicha negligencia grave se entregará al organismo correspondiente para su revisión y acción. Desde el comienzo del COVID-19, los líderes han declarado la importancia que es salir a coger aire fresco, estar fuera en los parques, en las veredas del condado, caminar, correr, bicicleta, hacer ejercicio. Y es una actividad segura. Queremos que nuestra comunidad empresarial permanezca abierta y también prospere. Este es un paso de ayudar a mantener la economía del condado de Seminole fuerte mientras se detiene la propagación del virus. Estuvo también aquí el Dr. Hendricks, del director médico de Advent Health Center Care, donde dice que apoya plenamente los esfuerzos del condado de Seminole para fomentar el uso de máscaras en público. Sabemos que las máscaras son altamente efectivas para frenar la propagación del virus. Usar una máscara nos ayuda a manejar la tendencia y asegurarnos que tenemos la capacidad de cuidar a todos los que la necesiten. Hemos visto un aumento de personas jóvenes también salir positivas. Ellos dicen que en Central Care un 20% de las pruebas que hacen regresan positivas. Usa una máscara, es una manera de proteger a otros miembros de la comunidad. Y es importante aún, si la persona no tiene síntomas, utilizar la máscara, ya que la podría transmitir a otros, porque muchas personas puede que no tengan síntomas durante la infección. Además, siguen haciendo lo que estén haciendo, pues lávese las manos, no se toque la cara, practique el distanciamiento social y use la máscara para que no empeore la situación. Dr. Sean Beniot, de Central Florida Regional, también habló. Dice que todos que visitan el hospital tienen que usar una máscara, que ellos están apoyando también al condado por lo que está realizando para proteger a la comunidad y que han visto pacientes desde las edades de 20 a 85 años de edad. Bridget Zamora, de Orlando Health South Seminole, también le da las gracias al condado. Dice que ha visto los números subir y que Orlando Health se mantiene preparado para cuidar a sus pacientes. Y las máscaras es lo que va a ayudar a esto a bajar nuevamente. El Dr. Todd Husty, director médico del condado de Seminole, dice que ningún hospital al momento está lleno. Sí se han visto aumentos, pero los están manejando. La enfermedad sí es algo malo, no es algo que se toma livianamente, y aunque no se ha visto mucho en niños, pero los niños también pueden estar gravemente enfermos y otras edades vulnerables también. Hemos visto ahora personas en ventiladores que hace tiempo no se veía. En la comunidad médica saben que las máscaras sí funcionan. Respete a sus vecinos, unos a los otros, respétense, use la cobertura facial para que nos protejamos los unos a los otros. Muchísimas gracias.